Hi, this is Dr. Tina Ureten. Today I'm gonna summarize a report from year 2012 prepared by BioInitiative Working Group in Europe, and the report is about fetal and neonatal effects of EMF. It's 16 pages of report, and it looks into the bio effects and adverse health impacts to the fetus and young children. And it says in the introduction section that infants' exposure to EMF has raised concern recently, and some countries have developed guidelines to limit it by avoiding the presence of hospitals or schools within a certain range of kilometers around high EMF emission sources. The risks it categorizes, and it starts with a risk of tumors. There are studies show significant increase of brain cancer in children, especially children using cell phones constantly. And there is a statistically significant association between radio frequency EMF exposure from radio or TV transmission towers and childhood leukemia. RF or radio frequency signals are the main signals coming from the wireless devices too. As a general health risk, EMF exposure might cause general health disturbance in children, and they summarize all the different studies about this aspect of EMF. Another important portion is EMF and cognitive functions. And it says here we cannot rule out that RF EMF exposure might influence cognitive and other central nervous system functions in children. If it is so, the consequences to public health can be enormous if ignored. We are in that stage. Fetuses, newborns, and EMF. Young children, especially fetuses and developing embryos, are more sensitive to all kind of environmental toxins. And they say also the stem cells, which babies and children have more of stem cells in their bodies, are the most sensitive to microwave exposure. And microwave also is kind of electromagnetic radiation. And here it says in one animal study done in 2012 showed the radiation, cell phone radiation of the pregnant mother can result in hyperactivity, impaired memory, and behavioral changes in the offsprings. And also there is a new study that shows the exposure to EMF in pregnancy is linked to subsequent babies' asthma problems. And it also explains laptop computers and fetuses, especially during the pregnancy, if the pregnant mothers keep their laptops close to their belly, especially the radiation level to the skin, bones, and blood genitals in those cases are very high, and they reach to fetus developing in the mother's body. So here is a simple the advice to keep distance between the laptop and the body during the pregnancy period. It also emphasizes the incubators used for premature babies, also expose them to EMF radiation or low-level electromagnetic fields, and it should be used only when it is needed. So all these findings bring the conclusion that with large body of information showing that the fetus and young children are more vulnerable than older persons are to chemicals and ionizing radiation. So the evidence for the relation between magnetic field exposure and leukemia in children is stronger than that for adults. As we know, WHO listed any kind of electromagnetic radiation as possible human carcinogens, and we have to be really careful. And here is the dipnote. It's not in public interest to wait. A precautionary approach may provide the frame for decision making where remediation actions have to be realized to prevent high exposure of children and pregnant women. So we have to protect these age groups, especially since 2012 when this publication was published. The EMF exposure level increased tremendously, and we have to take it serious to protect the kids. If you want to read the whole article, you can find it in internet search. The name of the report is Fetal and Neonatal Effects of EMF. Thank you and have a great day.